oral or say it again.
Maxillofacial.
Maxillofacial. Okay.
Oral and maxillofacial. Surgeon. That's what we are.
All right, let's try it. Hi everybody, I'm with Dr. Dachowski again.
Welcome.
And today we're going to be talking a little bit about, we're going back to the basics, what an oral maxillofacial surgeon is. For lack of a better term, that's a mouthful.
You're right. Yes, an oral and maxillofacial surgeon is a dentist who has additional training, or what we call a residency, in the specialty of oral surgery, or oral and maxillofacial surgery.
What's a maxillo? Like, what is that?
What is a maxilla?
What is that?
So actually, if you want to get technical.
We do.
Okay, well, when we're an embryo, the process.
Oh, we're going way back.
Way back. Yeah. When you're an embryo, the process that creates your face is called the maxillary process. And therefore, the maxillary region is the region of your face between your eyes and to your neck. So that's the maxillary region. From here to here.
That's very fascinating, because I feel like you see that word and already your brain's like blah, 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 because it's lots of letters.
Yeah, that changed back in the 70s. They went from the term of oral surgeon, which most people know us as, to oral and maxillofacial surgeon, and it's a term that kind of confuses the public, you know.
Yeah.
But that's defining the region that we're proficient at working in. That's where we do all of our trauma, our facial trauma, you know, from the eyes down into the neck. And that's where we do a lot of, sometimes unfortunately, cancer surgery or tumor surgery. And obviously in the mouth and the oral region, we're removing teeth and placing implants and things like that.
There's a difference between a dentist and an oral maxillofacial surgeon, and that a lot has to do with schooling, right?
Right, education is king, right? Education is always king. In our discipline, the oral and maxillofacial surgeon, again, goes through an additional 4 years of training and residency after dental school, sometimes longer. Sometimes they'll go through a fellowship of an additional 2 years in things like cancer surgery, reconstructive surgery, cosmetic facial surgery. All of the physician oral surgeons that are in our practice all have medical degrees. So today, the best of the best are selected to programs that offer a medical degree as well as the oral surgical residency. It's a grueling and challenging 6 additional years of training after dental school, and the result of that is someone who is very proficient, very bright, very intelligent, the best of the best, as I said before, and that's really who you want working around your body and your mouth.
So yes, as Dr. Dachowski was saying, all of the other surgeons that work at the oral surgery group are dual degreed.
Correct.
And sometimes those little initials after their names can get a little daunting. So can we talk about what they mean? DMD?
Dentist.
MD?
Physician.
FACS?
Fellow in the American College of Surgeons.
What does that mean?
Well, the best and only the best surgeons have that distinction, and it is a demonstration, again, of commitment, proficiency, intellect, and professionalism.
There's also DDS.
DDS is Doctor of Dental Surgery that, again, back in the late 60s and early 70s, certain schools like the University of Pennsylvania, for one, changed their dental degree to reflect a medical background to dental training, thus the DMD. But DDS and a DMD are interchangeable. They both mean dentist.
Oh, that's good to know. I've actually always wondered that.
Back when dentistry graduated into a profession from the barbershop, originally dentists were barbers, you know. A lot of barbers were dentists. Why were they dentists? Because they had a chair. They had a barber chair. And that barber chair was very accommodating for oral surgery. Interesting tidbit as well. Yes, most of the original oral surgeons were barbers.
Are you kidding?
I'm not. Look it up. Look it up.
I thought you were getting to this whole...
No, it's true.
Like a metaphor for...
No, there's no metaphor.
I don't know.
No, it's real.
They
yes.
had the chair.
They had the chair, so...
And so you just...
So when somebody had a toothache, they knew that the guy that had the chair was a place I could sit in and have a tooth
They also have
extracted,
like
or
questionable
in those days
instruments?
ripped out of my mouth. Yes, they had instruments, yes.
I'm learning so much
Yes,
from you.
you're learning so much.
So I have a better understanding what an oral and maxillofacial surgeon is. I can actually say it now.
Very good.
Yeah, I'm glad I work for you. And if you have any questions, of course, you can always call us or visit us on our website, theoralsurgerygroup.com. We'll see you in the next video.
Thanks for having me.
Bye.
Bye.